Hi, my name is Brian Anderson. I'm one of the physicians here at Mertu Medical Center. I wear several hats here at the hospital. I work in the clinic, the emergency room, in the hospital, up on obstetrics, and also do some work in the operating room from time to time. I'm the medical director of our clinic, and I serve on some administrative committees here at the hospital. And then I'm also the medical director for Mertu's Home and Public Health Department, and I'm one of the board members on the county's Board of Health. As the school year ended and summer began, COVID seemed like it was winding down. Cases were decreasing. CDC changed some of their guidance regarding masking, and things were moving in a positive direction. And so the last few months, you probably haven't heard much from public health. But now that school is beginning again, and unfortunately we're seeing an increase in cases of COVID-19, there's many people out there who are wondering what's going to happen with schools and our community this fall and winter. So our local healthcare system, Mertu Medical Center, as well as public health, felt like it was important to make a statement regarding the current state of the pandemic and what some of the local recommendations are from public health and from your healthcare professionals. To begin with, I just wanted to make some general comments. And the first one being, I would encourage you to listen to your healthcare providers. We deal with COVID-19 every day, whether it's in the clinic, whether it's in the emergency room, whether it's taking care of sick people on our medical surgical floor. COVID-19 has affected every aspect of our work life for the last year and a half now, so we're well acquainted with this illness. Most of the U.S. healthcare system is really on the same page regarding this pandemic. We're pretty unified as far as how we handle this and vaccine recommendations and preventative measures and things like that. The truth is, the major U.S. healthcare system, the leading medical centers around this country, and of course the CDC and the World Health Organization are all pretty much on the same page and have a lot of credibility when it comes to educating people about this. We see this as a public health issue. This isn't about politics. This isn't about the economy. This is at its core a public health issue, and that's what we're unified on our recommendations. And so really encourage you to listen to your healthcare providers. I'm trying to give people the best possible information so that they can stay healthy and so that we can minimize loss of life and minimize other negative impacts on our society. The other thing I wanted to mention was that we want people to be responsible. If you have an illness, a respiratory illness that you think might be COVID-19, we want you to get tested. Even if you're not feeling that sick, even if you think it's just a minor cold or a sinus infection, if you developed an illness that might be COVID-19, we want you to get tested and then follow the isolation and quarantine recommendations, treatment recommendations from your healthcare professionals. We want you to be part of the solution to this pandemic. We don't want you to be part of the problem, which basically means we don't want you to be a part of continuing to perpetuate this illness that has affected so many. And then thirdly, in terms of general comments, I encourage you to vaccinate. I'm going to be giving you some specific information about vaccines here, but we want you to vaccinate. It's the best tool we have right now to fight this pandemic. One of the best tools we have right now. It's probably the best tool we have right now. And so we want people to vaccinate.